Welcome to a virtual practice, Going Virtual with NextGen Office. We have an exciting presentation today to show many of the features already supported by NextGen Office for a practice in a virtual setting. Speaking today is Justin Berg, a Solutions Manager with NextGen Office since 2007. I have helped NextGen Office grow from a small startup to a profitable product line for a publicly traded company. With experience on the EHR, practice management, patient portal, and regulatory requirements, I have well-rounded knowledge across our products. Let's jump in. How many of you are future-proofed and can turn on a dime if necessary? COVID-19 was a reality check for many. Will you be able to stand strong, maintain reimbursement levels, and provide the care patients need when future challenges present themselves? In this presentation, we will go on a journey in the next half hour to show how technology can keep your practice strong and your patients healthy with a virtual strategy. What does it mean to be virtual? A virtual practice is not just about a telehealth video conference. Video will be the base, but other forms of electronic communication, such as audio and electronic messaging, will be vital to close the loop of virtual care. What is driving virtual care? The COVID pandemic, of course. Now ask yourself, what is your emergency preparedness plan? Will your patients get the care they need in the event of an extended quarantine? And is your practice doing its part to slow the community spread? And of course, are you protected financially if your patients stop coming to the office due to any disaster? Now you may see yourself staring off the cliff with a roaring ocean ready to sweep you away. But going virtual isn't just about disaster. Let us show you how virtual care will have a positive impact on your practice and patients. In 2018, prior to the COVID pandemic, the World Health Organization adopted a resolution on digital health, calling on governments to assess their current and potential use of digital technologies for health. In March of 2019, a draft of the global strategy for 2020 through 2024 was released, with additional updates in April 2019 and July of 2020. The vision of this global strategy is to improve health for everyone, everywhere, by accelerating the adoption of appropriate digital health. Okay, so how does this affect you? Bottom line, it will help you increase revenue. This increase in revenue will come from expanding accessibility to care, which will improve patient satisfaction. You are establishing a competitive edge against some and matching those pesky retail and urgent care clinics, which many organizations are losing patients to. And in the end, it is really about improving outcomes with engaged patients, reducing hospital readmissions, and improving your chronic care program. Now you should be asking, how do you go virtual now? In this section, we will show you how NextGen Office is ready now for a virtual practice. The first step is to establish a virtual strategy. Start by evaluating your dependencies for being in the office. Next, create goals from the opportunities identified. Then implement using NextGen Office tools and identify third-party vendors needed to fill gaps. Now, what might this look like? Here are a few examples of virtual opportunities that you may identify during your evaluation. Use this to help you get started on your virtual journey. Think about that fax machine or printer. How much paper and ink are you wasting every day? What about those phone lines? Do you rely on patients calling the office? An easy one to pick off is the requirement for patients to be in the office for an appointment. Let's dive into the face-to-face requirement and show how telehealth is made simple with NextGen Office. Before we dive into the actual product, it is important to know that Medicare has relaxed rules on telehealth reimbursement. Of course, you should speak with all of your payers to learn more. A telehealth visit with NextGen Office is quick to set up and easy to use. Scheduling a telehealth appointment is really all that is required to begin the process. From the patient's or provider's end, the audio and video is started automatically. And patients have many other options, such as paying an outstanding balance and entering and reviewing clinical information. Let's start the journey for the provider and patient. The provider starts a telehealth encounter by clicking on the appointment time from the NextGen Office EHR. From our EHR dashboard, the provider's schedule is listed with easy-to-use buttons for desktops and tablets. A simple click is all that is required from the NextGen Office EHR to start the audio and video. The patient also starts their journey by clicking on the time button from the NextGen Office patient portal. The NextGen Office patient portal works from any device. Upon login, the patient will be presented with a list of tiles. Simply click the button to start the check-in process. This process can be customized by the practice, making sure what is reviewed and entered by the patient is important to you. This is designed to help limit the amount of data that needs to be gathered from the patient and entered by your staff. Go back to the virtual opportunities we identified earlier and think about all the papers some offices are still printing just to be transcribed back into the EHR. In this example, the patient is presented with a diabetic foot evaluation sheet complaint form. The patient can easily complete the fields and navigate to the next sections, such as entering and reviewing medications. Upon completion, the patient can confirm all sections have been completed before the audio and video is started. Of course, I am making it look easier than it really is, but it is really that easy. To recap, both the patient and provider start their journey by clicking on the appointment time from an easy-to-access button presented upon login. The patient is prompted to complete important clinical information before the audio and video is started. The provider's video is started immediately with quick access to the encounter and options to review the information entered by the patient. Telehealth video conferences are not the only virtual solution ready to go out of the box with NextGen Office. In this next section, we will review the concepts of e-visits and virtual check-ins. E-visits and virtual check-ins are reimbursable events under Medicare telehealth services. This is centered around the patient's ability to initiate electronic communication with the provider. This could come in the form of a secure message or uploading a document for review. The patient has to initiate the communication for it to be a reimbursable event. The patient accomplishes this easily with the NextGen Office patient portal. Upon login, the patient can easily navigate to messages using tiles. Click Message a Provider, and a new message can be sent by simply clicking on New Message. Documents and pictures can also be uploaded with just a few clicks. With the NextGen Office Patient Portal, these features are available now at no additional cost. If you think that looked easy, let me show you how easy it is for the provider. A provider can quickly view messages from anywhere in the NextGen Office EHR. From any screen, the messages icon can be clicked, and incoming patient messages are easily identified. Let's do a quick recap. We reviewed some initial steps for your virtual strategy with telehealth, e-visits, and virtual check-ins, all available at no additional cost. As you evolve your virtual practice, it is important to continuously evaluate opportunities and create small goals to achieve them. A virtual practice can be so much more. Let's review some steps across the patient journey that you can include in the evolution of your virtual strategy. It all starts with front office functions that can be completed virtually. For online new patient registration and scheduling, we are integrated with ZocDoc. This allows patients to schedule their first appointment without ever needing to contact the office. To grow your online presence, we partnered with Doctable through their reputation management platform. Get instant feedback from patients and boost your online reputation. Doctable has helped us deliver on COVID needs with the concept of the virtual waiting room and intake forms. Interact with the patient while they are in the car to help reduce the spread. As reviewed earlier, the patient can enter and review medical information with just the NextGen Office Patient Portal. Let's highlight a great feature Doctable developed in response to the COVID pandemic. The virtual waiting room with Doctable makes it easy and safe for practices to screen patients and streamline the check-in process in the new contactless era. The front office staff can operate from the dashboard to monitor and communicate with patients via text message when they arrive in the parking lot. Contact with the patient occurs 24 hours and 1 hour prior to the appointment to fill out health questionnaires. The patient can send a text when they arrive in the parking lot to notify the staff, and the staff can text the patient to come into the office when ready with instructions. Important clinical functions can be completed virtually. Almost all prescriptions should be prescribed electronically, including controlled substances. Prior auths are now virtual with Cover My Meds at no additional cost. This is an important step to improve patient outcomes with medication adherence and reduce phone calls to the practice. Please stop using that fax machine and transfer to eFax. Your staff and trees will love it. We also have hundreds of electronic lab connections to help streamline the ordering and the result process. Results can be electronically shared with patients via the NextGen Office patient portal. Use direct messaging to send the requisitions for radiology orders and consults to improve transitions of care. Let's highlight the electronic prior authorization workflow. During the prescribing process, the provider will be notified of the need for a prior auth. Click Create to start the process. Of course, most providers would not complete the process. Thus, they can quickly task this to the appropriate personnel. To close the patient journey, back office functions are now virtual. Statements should be sent directly to the patient portal with the option to pay online. With just a couple of clicks, patients can request or schedule appointments. Just as easy are medication refill requests that can be requested by patients and managed by your office. Now take a step back and think about all the paper and ink you can save by tackling just a few of these in your virtual strategy. Let's go ahead and dive deeper into the electronic statement flow. During the statement generation process, there is an option to push the statements to the patient portal. Automatically, the patient will receive an email stating the statement is now available with a quick link to log in. This email template can also be co-branded with your organization's logo. Upon login, the patient will be notified of the balance. With a quick click, the patient can review the balance and has a quick option to pay the bill. To save time, the patient can use card on file or enter it manually. Let's not stop there. Maybe the patient realized they need to schedule a follow-up or request a medication refill. The tiles from the dashboard make it easy for a patient to move this forward electronically. To recap, it only took us a couple of clicks to understand that a balance was present, review the details of the statement, and pay the balance online. And of course, we have a number of easy options for the patient to utilize in your virtual strategy, such as scheduling an appointment and requesting medication refills. As your virtual practice evolves, always remember what is important: the patient. Do your part to prevent the spread and keep your patients healthy. Remember to improve patient care with virtual tools to help manage clinical tasks. And please offer your patients options to pay online with just a few clicks. Paper statements can be a pain for you and the patient. Remember, NextGen Office virtual services are available now. A virtual strategy will improve the patient experience and help prepare for the next emergency. Request a demo now to learn more.